I'm Dr. Kelly Tappenden. I am professor and head of the Department of Kinesiology and Nutrition at the University of Illinois at Chicago. My interests and specialty relate to individuals with intestinal failure. Specifically, we look at how the intestine can adapt. That means that when intestine is missing and someone isn't able to digest and absorb what they consume, their food, we look at how we can regenerate the intestine, cause it to grow bigger, to become more functional, so that individuals with intestinal failure aren't so reliant on intravenous nutrition. When speaking to colleagues, I really encourage anyone with an interest in clinical nutrition to acquaint themselves with the Oley Foundation. The Oley Foundation is an excellent resource for patients who are receiving enteral or parenteral nutrition, as well as their caregivers. So any consumer of clinical nutrition will really learn a lot from becoming associated with the Oley Foundation. Not only does Oley connect the dots for clinicians and consumers, but it also lets consumers see other individuals who are dealing with the same thing that they are, because this is a rare problem, someone needing specialized nutrition support. And so to be able to be part of that community where others are going through the same thing is incredibly important. Being a member of Oley has been very important to me personally. I have been able to forge some excellent relationships with providers who are across the country in this field, but more importantly with consumers who are not patients that I've worked with in the past, but are looking for a different perspective, and for myself, gaining a perspective that they can bring that I haven't heard of before. And so in trying to care for patients with intestinal failure or specialized nutrition support needs, being exposed to that entire community and having everyone brought together and provide resources like Oley does is really irreplaceable. Oley impacts specific patients in many, many ways. It provides an educational forum for patients to be able to learn about the disease that they're dealing with. It also provides resources to patients where they may not be able to find various support for formula. There's formula that is donated and they're able to access specialized equipment that they need. That's really, really a game changer for many individuals. And it also exposes them to a community of other individuals who are dealing with similar diseases and issues that they are. Having patients be a member of the Oley Foundation provides them with an additional resource that we may not be able to do in a single center. And so hooking up patients and having them become members of Oley really gives them a wealth of knowledge that they can't get from their provider specifically. I would recommend Oley to a patient just as soon as they're getting that initial diagnosis, wherein they're going to need specialized nutrition support. What that will do is help give them the educational resources that they need, as well as some of the technical issues that need to be addressed. There'll be some education available there, but it will also expose them to other individuals going through the same thing as them, or having already gone through it, and therefore provide advice from that patient's perspective. Oley conferences are really a wonderful melding of clinicians and consumers, patients and caregivers. It's this unique forum that many of us in medicine don't get the opportunity to engage in. We hear things here together from both perspectives, and I think that's really useful. Most meetings are clinicians, their medical perspectives, and only those professionals. Here, we're all together addressing the same problem, and I think that's pretty powerful.